Hi everyone, it's Ryan Liberty. In this video, I'm going to answer the question, what is borderline personality disorder, also known as BPD? Ooh, let's find out. Okay, here we are. We're going to get into what is borderline personality disorder, also known as BPD. But first, I just have to go into a little thing I've always got to say when we're talking about these things. Got notes down below I'll be referencing because there's a lot to cover here and I can't always remember to get all of it out. This is just a description of what borderline personality disorder is. It is not the diagnostic criteria. If you're looking for a diagnosis, you'll have to go see a professional. This is not to be used to diagnose anybody, so I gotta say that. These are only, the word borderline personality disorder, if for any reason that bothers you, if it makes it hard for you to heal using that word, then that phrase, you can let go of the phrase borderline personality disorder. This is just meant to point you in a certain direction to give you an idea of what's maybe going on in your life or somebody else's life that you know. A personality disorder is not something that is set in stone. It is not something that you're stuck with. Personalities can change, and there's always research being done on personality disorders, and we learn more as the years go by. So don't think that because you hear these things and you're convinced that you have this personality disorder, or maybe you've been diagnosed with it, that's the end and that's it. There's no reason to feel that you're stuck with it. It can be changed. And there is a stigma around people who have personality disorders that I hate. I wish it would go away, that they are evil or they're bad people. That is not true, and we'll get into, especially borderline personality, why that's frustrating for me to hear. But they are not evil people. They are not bad people. However, I do have to say a lot of people come to personality disorder videos because they're seeking information about somebody who's abusive to them. And whether they have a personality disorder or not, whatever the case is, if somebody's being abusive to you, then you should take steps to distance yourself from that person, take steps to take care of yourself and get the support and the resources that you need to help yourself. Don't worry about whether they have a personality disorder or not. That's not important. Just take care of yourself. And with all that said, I must say that somebody has borderline personality disorder, they may not be abusive. It's not like some kind of requirement or anything. Now, all of that out of the way, let's get into what borderline personality disorder is, and then later what it feels like for somebody who has it. So it's something that begins in early adulthood, and it involves a lot of these things. It doesn't have to be all of them. So there are intense attempts to avoid real or imagined abandonment, and this is one of the core features of borderline personality disorder, is that you always feel like somebody's trying to abandon you and you need to keep them around, it's intense. It's like, oh my gosh, I can't believe they're leaving me, I need them, what are they doing, get them back, all those kinds of things. We'll get into how it feels. There are unstable and intense interpersonal relationships because of this, so very often you feel like you've got somebody who you meet them and you think like, oh, this is the best person, I'm so excited, they're like my savior, I love having them around, and then very quickly it switches over to, why aren't they around, why aren't they here when I need them, I don't like them, I hate them, and it's this constant switching back and forth when you think about people and you reevaluate them, which leads to unstable and intense relationships. There's a consistent, unstable sense of self. So somebody with borderline personality disorder may not be able to describe who they are to somebody so well. They may not be so clear on what they enjoy, qualities that are essential to themselves, because there's this constant reevaluating and switching back and forth between things. It makes it hard to explain your identity to somebody. There is impulsivity and self-destructive behavior, so things like reckless driving, binge eating, overspending, substance abuse, gambling, all those kinds of things may show up in borderline personality disorder. There is suicidal behavior, threats, and self-mutilation that may occur. There's emotional instability due to the mood fluctuations because of all these unstable relationships. There's persistent feelings of emptiness. So especially when you're feeling alone, when you feel like everyone's abandoned you and you think about yourself, it feels like there's really nothing inside. You feel kind of hollow, and we'll get more into that later. There is inappropriate anger, and you have trouble controlling your anger, especially when you feel slighted and you feel like somebody has abandoned you or somehow gotten one over on you. There is sometimes there's strong dissociative symptoms and also paranoid ideation. So paranoid ideation is a suspiciousness about others who may want to harm you. And dissociation is when you kind of like check out because these emotions are so intense that you just zone out and like split yourself off from them. So you may see either one of those things going on. You'll find that your goals and your plans are very often shifting. So you may have something you want to do on the weekend and the next day you change what you want to do. Maybe you have a career path that you want to go down and then a week later you change your mind about that. It's very often shifting and not the way that normal people, not the way that people who generally would evaluate their goals and their plans. With somebody with borderline, it switches a lot. There's just always this changing in their mind about what they want to do and where they're headed. They have a compromised ability to recognize the feelings and needs of others because of hypersensitivity to feeling slighted. There's those intense relationships, and they are marked by mistrust and neediness. And there are fears and preoccupation about the future and losing control. Something that I noted while researching about BPD is that 8 to 10% of them actually complete suicide. So although many times somebody with borderline personality may threaten suicide to keep somebody around because of that fear of abandonment, 8 to 10% of people will actually complete the suicide. So anytime there's a threat, it should be taken seriously because it likely could result in an actual suicide. So don't think that somebody's just doing this for attention. That's not true. There is treatment for borderline personality disorder. Like all personality disorders, for BPD in specific, you could use things like dialectical behavior therapy, cognitive behavioral therapy, transference-focused psychotherapy. But the best plan, of course, is to get in with a professional who can come up with a treatment plan to address your particular issues. But there is treatment, so go ahead and get out there and get treatment. I know for borderlines in specific, there was a lot of talk for a while about how it's something that can't be cured. That's not true. That was just not true. So go ahead and get in treatment and get the help that you need. Now, what does it feel like being somebody with borderline personality disorder? As far as the way it feels in your body, you're going to have any of those symptoms of anxiety or trauma. And I have videos on those, so go ahead and look them up if you want to know what you might experience in your body. But briefly, you may have like racing heartbeat, you may have trouble breathing, you may find you're sweating or blushing or tingling in your toes. Like all those times when you're getting those intense emotions, you may be feeling these things. As far as what we're thinking in our head and what's going on, you may have trouble explaining who you are. You may think things like, why is she always leaving me? I'll never have a lasting relationship. I need to know exactly what he's doing right now. Nobody loves me as much as I love them. So really thoughts focused around abandonment and getting people to be around you. Emotionally, what's going on? There's a lot of different emotions and they're all intense. You got things like feeling shame, feeling hopeless and rejected because you feel like people are always leaving you, and you also are aware that you hurt people when you get angry and you kind of retaliate at them for abandoning you, so you feel bad about that and you feel shame. You may feel evil or non-existent for this reason, and that's why I said at the beginning of this video, I wish people would stop saying things like people who have personality disorders are evil. That's just a feeling that somebody with borderline personality disorder has. You are not evil if you have this problem. You often feel abandoned. You feel angry, sensitive, lonely. You may have suicidal thoughts. You may at times not be able to even put labels to your thoughts, something that's called alexithymia, because they're just all over the place. You may feel like you're never satisfied and you can never catch a break, unless somebody who you feel has abandoned you has returned to you, and then you may feel elated and happy and excited that they're back. And at times when you're alone and you don't have anything going on, you may feel very bored and very unexcited with day-to-day life. Now, behaviorally, a lot of different things show up when we're talking about borderline personality disorder. You're going to feel that anger when you feel abandoned. And what we're talking about when we say that somebody's feeling abandoned, it could be any small thing that makes somebody with borderline feel abandoned. So it could be that somebody changed plans on you. It could be that somebody showed up late. It could be as simple as they're checking their phone or their watch to see what time it is, and that sends you the signal that maybe they don't want to be with you, and it just sets off this whole chain reaction of how they're slighting you and you don't feel good around them. So any of those little things could be an abandonment. You may feel sarcastic, bitter, or have verbal outbursts as a result of all of this. You may self-mutilate just to feel something, or you may have those suicidal behaviors. You may quickly see people as ideal, rush into things, and then turn around maybe even hours later and get angry at them for not texting you back right away, those kinds of things. And there's this constant cycle of idealizing somebody and loving them so much, and then being upset with them when they're not around, and then lashing out at them, and then being upset with yourself for lashing out at them, and then apologizing and wanting them to come back to you. And if they do come back to you, it just kind of like cycles around and around and around, which makes everything very intense and very confusing for both people. You may find that you empathize with people only when you believe that somebody's going to be there for you. So you feel calm enough that you can see somebody else's perspective, but only when you feel like they're around. When you feel like somebody's leaving or abandoning you, it's very hard for you to feel empathy for them because you're too caught up in your own emotions, and you're afraid and frustrated and angry and sad that they're abandoning you for one reason or another. You may find that you have those sudden changes in goals, friends, careers, plans, sexual identity, and values. You may do things like gamble, compulsively shop, drive recklessly, have unsafe sex, abuse a substance, etc. Anger, and we talked about the cycle of how things go. There's constantly cycles of anger and sadness and shame and guilt and love and all kinds of things going on. And you may find that you sabotage your efforts right at the moment when you're about to succeed very often with this. So borderline manifests in a lot of different ways. I'd love to hear your experience of how borderline shows up in your life. And if you have any questions or comments about this, please leave them below, because this is a very large topic. But I appreciate you being here to learn about it. And I just want to say one more time, you're not evil if you have this disorder, because I know this is something that people with borderline get tripped up on. You're not an evil person. Thank you for taking the time to learn about it today and to learn about mental health. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.